Electronic fetal monitoring in labour is the method that we would recommend for women that have risk factors. That would be either before labour or maybe identified during labour. The confidential inquiries have repeatedly recognised issues with not only identifying abnormalities on the CTG, but also with taking action.
So the key issue with CTGs is how do we make the national guidance in the UK and the FIGO guidance work in practice? How do we make the 250 pages of some of these guidelines work at the coalface? So we have developed a sticker that's consistent with both of those two things. And I think that has a number of advantages. It makes a single system available for all staff, so there's a common language about CTGs and the action required for different CTGs. We have been using the sticker system, just as I've described, for a number of years, and that has been associated with significant improvements in outcome.
I've got a few concerns over your baby's heart rate, so what we need to do is get you up and get you onto the bed on your left-hand side, okay?
Okay.
So the key thing about CTGs is first of all, accurate classification. I think the sticker really helps with that. But the second thing is to take into account the clinical context of the trace.
But yes, it's coming out and classifying it's pathological.
Okay.
There's lots of contractions. I think she might be hyperstimulating.
Okay, I agree with you there. So I think we'll turn the syntocinon off for the minute, Susan, okay?
Okay.
Katie, you're just going to go and get one of the registrars to come and see you, all right?
One of the commonest causes of a pathological CTG is hyperstimulation due to excessive syntocinon. As you can see in the scenario, it's really important to recognise that, turn down the syntocinon, and by that way you can then possibly avoid unnecessary caesarean section. The sticker alone is probably insufficient. It's really important to train staff to use the sticker so there's a common language and a common classification system for all staff to both recognise problems and react to them. Using the sticker and after being trained to use the sticker has resulted in improvements in outcomes in babies both in the US and the UK. Certainly in Bristol there have been 50% reductions in babies born in poor condition, and this has translated into improvements in babies going to school with cerebral palsy here in Bristol.
If you'd like to learn more about how prompt training can improve care on your labour ward, or to sign up for our courses, please visit www.promptmaternity.org or email us on info@promptmaternity.org.